My name is Barbara Klein. I got my first colonoscopy at age 60, which is really late in life, and I know that, and I don't recommend that. That's why I'm here, to encourage everybody. Don't be afraid of the prep. It's not that big a deal anymore, but with my busy family, I had all the excuses for all the wrong reasons, so I made an appointment with my primary care physician, Dr. Ainsley.
Mrs. Klein came in for her yearly wellness appointment. The role of primary care is to help patients get the appropriate screenings they need at the appropriate intervals for things like cancer. When the patient comes in, we talk about their family history and any family history of colon cancer. And then we talk about how that relates to the typical age that we start colon cancer screening now at 45. So if it's an average risk patient without any family history, without any symptoms, then 45 is the recommended age now. And so we talk about the gold standard colonoscopy, or if they're reluctant to do that, we do talk about doing one of the stool DNA tests, because when we focus on early detection, the point would be to do the screening test before the patient has symptoms and catch the problem or the cancer early, and so that we're able to treat it aggressively from the get-go, and the patient will have better outcomes at that time.
Screenings are very important, however you do it. And Cologuard, I'm sure, works for a lot of people. Mine came back, it was not good. Dr. Ainsley's office called me right away and said that it came back, it was a problem, and that they needed to get me in as soon as possible to see Dr. Converse.
Mrs. Klein was referred to us from her primary doctor due to a positive stool DNA test, or Cologuard. That's what brought her to us to pursue a colonoscopy. All patients with a positive Cologuard should be followed up with a colonoscopy. An abnormal stool DNA test, an abnormal stool immunochemical test, or abnormal fecal occult blood test may be your only signal that there's an issue that needs to be addressed and identified. So Mrs. Klein, when she presented for her colonoscopy, had several polyps, a larger one that was lower down in the rectal area that returned positive when we removed it for invasive adenocarcinoma. So we set her up for specific blood tests, set her up for CAT scanning, and referred her to our colorectal surgeon, Dr. Billings.
Dr. Billings called me personally and told me the results showed that I did have cancer and that I would require surgery. And in the moment, the fears are so real. Dad, what does this mean? You have so many questions, but the doctors are right there, to answer all your questions, and I trust them, and you take baby steps. We really did. We took baby steps. We're going to do this, and then we're going to do that. So he was on it. He knew what he was going to do. He was going to go in there and take out the damaged part of my colon and resection it.
Mrs. Klein had a very successful operation with Dr. Billings, and we recommended that she return in a year for a repeat colonoscopy, not so much to look for the cancer that was removed, but to look for new lesions that can pop up. She's at higher risk for new polyps, and we want to get them when they're really small and they don't develop into the issue that she had. Colorectal cancer can develop anywhere in the colon, and a lot of people are under the assumption that, well, I'm going to notice a change in my bowel habits. I'm going to see blood in my stool. And that may be the case if the lesion is in the rectum or lower in the left colon sigmoid area. But you're just as much to have the colon lesion be in the far side of the colon, where any bleeding will get mixed with stool and you won't notice it. Unfortunately, we're finding that colorectal cancer is popping up in younger people, and the recommendations have moved from starting screening, whichever method you choose, at age 50 to now starting at age 45, with the hopes that we're going to catch those in younger people at an early stage and their outcomes will be much better.
It's a big deal if you don't get screened and then you find out you could have prevented something. It's so important to get your screening. It's not just for yourself and your health, it's for your family's sake. You want to live to see your grandchildren. It's just so much can be done with early screening that they find out and catch it right away.